Assalamu alaikum. My name is Moiz and my roll number is 2021 DVM 93. My presentation is about a case study of unilateral testicular enlargement in a 5-year-old Arabian stallion. Let's move towards the history and initial presentation. The horse was presented to a vet with the chief complaint of severe colic signs, and the key finding that the vet seen were firm, cool, and enlarged left testicle. Also, after the physical examination, nothing abnormality was found. So the initial treatment was given flunixin meglumine 1.1 mg per kg, and the horse referred to the animal hospital. Let's move toward the clinical exam. Colic sign subsided at the hospital. Also, the TPR, mucosa, and the CRT, all these things were in the normal range. Also, the lab work, which include the PCV, plasma total protein concentration, and peripheral lactate concentration, all these lab works were absolutely normal. But the persistent complaint was that still present, that was left testicle still enlarged, firm, cool, but now the testicle was non-painful and animal was non-painful. Now let's move toward the initial diagnosis. Transrectal exam revealed enlarged left spermatic cord and also normal orientation of epididymis. Upon the ultrasound exam of the secretory region also revealed there is mild enlargement of spermatic cord as well as there is increased echogenicity of the testicular parenchyma. So the tentative diagnosis was spermatic cord torsion. As we can also show in the figure A, we have ultrasound of the left testicle at the initial presentation, and at figure B we have irregular echogenicity of the testicular parenchyma. It means that there is something going on with the testicular parenchyma. Let's move toward the diagnostic investigation and differentials. The horse was kept under observation for 36 hours. During the observation period, the horse was systemically stable, no colic signs, maintained good appetite, and passed normal manure. Also, there were some other findings that we will discuss in next slide. During the observation, serial examination and ultrasound monitoring was performed. Let's move toward the differential hematocele testicular neoplasia, orchitis, and epididymitis. The orchitis and epididymitis can be ruled out as the orchitis in orchitis animal has pain and the testes are usually warm. In epididymitis there is abnormal orientation of head and tail of the epididymis, which is not in our case. Testicular neoplasia usually slow progressive, also non-painful, but our animal has sudden pain. Hematocele usually have a history of trauma. Let's move to the confirmatory diagnosis. Upon the 36-hour observation, the host developed diffuse secretal edema. Also, upon the ultrasound, there were increased irregular echogenicity. This shows that there is something happening with the testicular parenchyma. Also, the diameter of the left spermatic cord was double at the as compared to the right one. With the Doppler ultrasound, it was seen that there is a reduced blood supply to the left spermatic cord as compared to the right. Also, we can see in the picture that there is a diffuse secretal edema, and in the picture A, we have the left spermatic cord diameter which is twice as that of compared to the right one. So our confirmatory diagnosis would be the 360-degree spermatic cord torsion, or maybe more than 360 degree. Uh, and this show that initially when the torsion occurred, the horse showed the sign of the colic, but due to low blood supply to the testes, the horse undergo ischemic necrosis, and that lead to the animal in non-painful condition afterwards. Let's move toward the treatment and the outcome. The horse was prepared for hemicastration. During the hemicastration, in hemicastration we just remove the one testis. During the castration we saw the 360-degree torsion, and with the histopathology it also confirmed that the ischemic necrosis was seen at the left side. Outcome was the animal was recovered. Now the discussion and the key takeaways. The colic sign can subside in severe spermatic cord torsion which is greater than 360 degree due to ischemic necrosis. Thus, the pain may not be a reliable indicator. Usually in 360-degree torsion or greater than 360-degree torsion, the blood vessels and the nerves endings Usually the tissue goes to the ischemic necrosis, can't get the proper blood supply, or due to which the tissue become dead, and we don't find any pain. And with the help of B mode and Doppler ultrasonography, we can find the heterogeneous echogenicity. With the help of B mode and with the help of Doppler ultrasonography, we can see the decreased blood flow that will further confirm our diagnosis, which is 360 degrees spermatic cord torsion. In 360-degree torsion, epididymis head and tail are in appropriate orientation, unlike in 180-degree torsion. So this is a differential also. uh, Hemicastration is the treatment of choice to preserve the future breeding potential. Animals with unilateral spermatic cord torsion are prone to torsion in contralateral spermatic cord, mean that the other side of testis can also be prone to torsion. So we have to educate the owner. Thank you very much.